Hello, I'm Emma-Louise Coffey and you're welcome to the Dairy Edge, the Teagasc Dairy podcast. We're bringing you the latest information, insights and opinion to improve dairy farm performance. As part of the Animal Health Ireland and Teagasc CalfCare Virtual Week, I'm joined by McGrath, Muireann Conneely and Niamh to discuss the care of the newborn to maximise health in the early days. And I first asked Michelle why calves have no immunity at birth.
I suppose the development of the calf's immune system is actually quite complex because the womb is there as a protecting it from all types of diseases in utero. So because of this, no antibodies haven't been exposed to any antibodies before they're born, like happens in humans. So that's why it's so important that calves are fed colostrum as soon as possible after birth, because even when they're being born, they're being exposed to infectious agents in the birth canal. So that's why it's just, so we can't overemphasize how important it is to get that colostrum in as soon as possible.
And Michelle, when we think of colostrum, we often think of the 1-2-3 rule, and that's pretty much what's drilled into us, and it emphasises the importance of colostrum. But to get some more detail from you, the number one is the first milk. Why is that first milk so important, and maybe what has colostrum to offer us when we compare it to standard lactation milk?
Yeah, so the one is the first milk, as you say, and it's the from the first milking, the cow has super high levels of antibodies in that colostrum. It's even the second milking, there's only half the number of antibodies, so it decreases rapidly, and by milking 6 or 8, it's back to normal. So even for colostrum, it should be only the first milking given for the first feed within 2 hours of birth, because the calf's ability to absorb antibodies reduces every hour from birth. So it stops by the time the calf is 24 hours of age. So they won't be able to absorb these magic antibodies after this time. While they will act as a local protection in the gut, they won't be absorbed into the calf's bloodstream. And why the antibodies are so important is because, as I said, the calves have no antibodies when they're born, and it takes them up to 3 to 4 weeks of age before they develop their own immune system. So they need these antibodies to get them through that phase.
And looking then to number 3, it's the 3 litres, or the quantity that you're feeding the calf. How is that calculated?
Yeah, so a typical dairy calf is about 35 kilos when born, and what they recommend is 8.5% of their body weight. So 8.5% of 35 turns out to be 3 litres. So it can seem like a lot in a small calf. Obviously, if there's more of a Jersey cross in it, then you won't need quite the 3 litres. But that's how it's calculated. And I find if you are feeding colostrum and you have to give them 3 litres, it's important to have a bottle or a stomach tube that can take the full 3 litres, because if you stop kind of midway through the feed, that it can be hard to get the calf sucking again after. Like ideally you want to feed with a bottle, but like it can be quite time consuming, and if you have a lot of calves to feed, then obviously the stomach tube might be quicker, but it's probably a 2-person job. You need one to restrain the calf and then the other to pass the tube. But and the other thing about tubing is it can be actually harder to get the calf to suck post the first feed, because they haven't had that experience when they were born, and they can kind of lose that a bit. So obviously if it's the middle of the night then and you're tired and there's lots of calves, then the stomach tubing is the way to go. But if you have any time, if you've any bit of extra time, it's worth putting it in to getting the calf to suck at that first feed, in my experience anyway.
That's great. Thank you, Michelle.
Okay, thanks, Emma.
And now we hear from Muireann Conneely on how to assess colostrum quality.
Well, there's a number of factors that influence colostrum quality. One factor is the time of colostrum collection in relation to when the cow calved. So the longer the time period between when a cow has calved and the colostrum is collected, the lower the colostrum quality. So it's really important to collect the colostrum as soon as possible after the cow is calved to make sure that it's of the highest quality possible. Then the other factors, I suppose, are the age of the cow. So older cows have been exposed to more disease during their lives, so they produce colostrum with a higher antibody concentration. And the antibody is the measure of the colostrum quality. So they've been exposed to more disease and they have higher colostrum quality. That's not to say that colostrum quality from heifers is not good. In a lot of cases, it can be very good. So, but it's just that the older cows tend to be higher. Also, the volume of colostrum is related to its quality. So cows that produce large volumes of colostrum tend to have colostrum with a lower antibody concentration. Also, the time of the year of calving has some effect too. So the cows that calve later during the spring tend to have lower colostrum quality than cows that calved earlier in the spring or cows that calved in the autumn. And that's probably related to the fact that cows that calve later might have been slower to go and calve for various reasons. Maybe poor health or other factors which might indirectly lower their colostrum quality.
And looking then to testing the colostrum, Muireann, and like if you could give us maybe the KPI or the key metric that you would use, as the figure that is important for colostrum quality.
Yeah, so if you're measuring the antibody level in colostrum, the antibodies or immunoglobulins, which are the cells that protect the calf from disease, the figure there that tells us the colostrum is of good enough quality is 50 milligrams per mil. Now, if you are measuring it on farm, there's no way of getting that number on farm because you need to do an ELISA test in a lab to measure the IgG concentration. But if you use a Brix Refractometer, which is the most reliable and convenient method for measuring colostrum, IgG, or antibody on farm, the cutoff point there is 22%. The Brix Refractometer scale reads from 0 to 30, and if the value is 22%, above that is colostrum that is of high enough quality to feed.
And you mentioned the Brix Refractometer. Some people listening in today mightn't necessarily have heard of it or have heard of it, but have never accessed one. Where can that be purchased, Muireann? And could you give us an idea of the type of cost to purchase a Brix Refractometer?
Yeah, well, they can be purchased online. So there's a number of retailers selling them online. I know that there is quite a variation in cost. You can pay up to a few €100 for a really top spec one, but you can get a very decent one for 30 or €40. You used to be able to get them on Amazon.
And maybe I know, like say, we can't watch you doing it, but could you give us maybe the 2 or 3 steps of how the Brix Refractometer actually works?
Yeah, so it's a little handheld device. It works. It's called a refractometer because it refracts or bends light, and the amount it bends the light will depend on the density of the liquid that the light is passing through, and the density of the liquid, in this case colostrum, is determined by the amount of immunoglobulin or antibody that's in that liquid. So you get your few drops of colostrum, you place it on a little glass screen, then you hold it up to the light, and basically, it's difficult to explain this without actually having one to show, but you look through an eyepiece at one end, and when you're looking through it, you'll see a little scale. You'll see the Brix scale on the inside, and you'll be able to, there'll be a threshold between a dark colour and a light colour, and that threshold is the colostrum quality. And again, on that scale, if it's above 22, the colostrum is good enough to feed to a calf. So it's actually very easy to use, really.
And moving on then, Muireann, to, I guess it's a kind of a side note, but it is something that may affect quality. When you think about storage, what is the best practice in storing colostrum for calves? Like, a lot of people have it in a bucket, sitting in the parlour. Is this recommended, or is there something that you could do to improve it?
Yeah, well, no, that wouldn't be recommended. Storage is very important when it comes to maintaining quality. So if basically the storage conditions won't affect the antibody concentration in the colostrum, but it will affect the amount of bacteria that's present. And if you leave it out at room temperature or just in the parlour, I know on a cold day it might be colder, but if you store it at greater than 4 degrees, the bacteria will multiply much more quickly in the colostrum, and high levels of bacteria in the colostrum will actually bind to the antibodies and will stop the antibodies passing through into the calf. So even though there might be enough antibodies in the colostrum, if there's loads of bacteria present as well, the calf won't absorb these antibodies. So the best thing to do is to refrigerate it immediately. And if it's refrigerated immediately, you can keep it in the refrigerator and it'll be fine to feed for up to 2 days. But after 2 days, if it's not fed, it should be discarded. Or you can put it in a freezer, and if it's frozen, it will be safe to use for a year after it's frozen.
Thank you, Muireann.
You're welcome, Emma-Louise.
And now to Niamh Field on how to eliminate the risk of Iones to newborn calves.
Basically, Iones disease is a bacterial infection of cattle, sheep, and other ruminants. And unfortunately, there's no cure for it. It's highly infectious, and usually cattle become infected as young calves in the first few weeks of life. So adult cattle usually shed the bacteria in their feces, milk, and colostrum, and that's how young calves get infected, by coming into contact with those. Once they are infected with the bacteria, it kind of settles in the intestines and causes damage to the animal's gut wall. Now, it progresses silently for a number of months and years. So you typically don't see any signs of Iones in an infected animal until they're at least 2 years old, and usually older. So in dairy cows, it's quite common that they might have 3 or more calves before they might show any signs of the disease, even if they were infected as a young calf themselves. So when it comes to the actual clinical signs you'd see, or the symptoms, when the gut wall damage progresses enough, you initially farmers might notice reduced productivity in the animal, so kind of reduced feed conversion efficiency, or maybe a slight dip in milk yield. Then it might progress to loose feces or scour, and then progressive weight loss, even though the animal would still be eating well. And eventually, if they're not culled for any of those reasons, they do eventually die of the disease.
And how can farmers investigate the Iones status of their herds?
So if farmers are kind of wondering if they have Iones disease, some farmers might be suspicious based on clinical signs they see in their cows, or just if farmers are concerned about it and want to know what's going on in their herd. The best place to start is by talking to their vet. Now, there is a voluntary Irish Iones control programme up and running in Ireland for both dairy and beef herds. It's managed by Animal Health Ireland, and it has great supports for farmers. Once they get involved, there's access to specially trained vets all over the country to talk to about Iones testing and control of the disease, and also good advice on how to prevent bringing Iones into your herd. So that would be my main piece of advice, is to get in contact with your vet and ask them about the Irish Iones control programme. It's very good as well, because the programme has support from milk processors, which provides subsidised herd testing for Iones, and also advice and support through risk assessments done on farm that can really get down to the specifics for your individual herd of how to prevent Iones coming in, and if you have Iones, how to control it.
And I guess, when we think of Iones, and our conversation today is mainly around the, I suppose, management and care of the newborn calf. And, you know, speaking with Michelle earlier, you know, she explained that there's absolutely no immunity in a newborn calf, and they're, you know, vulnerable to any disease. But could you give us, I suppose, your advice and tips on how you can eliminate the risk of iones to newborn calves?
Yeah, so definitely newborn calves are totally vulnerable to all infections straight after birth, and iones is definitely one of those. So it is young calves that are most vulnerable to becoming infected. Up to about 6 weeks of life, they're very vulnerable to becoming infected with iones. So again, as I said before, adult cows or adult animals typically are the ones who shed iones bacteria in their feces particularly, but also in their colostrum and their milk. So it's absolutely critical if you have iones in the herd or are suspecting you could have iones in the herd to prevent calves coming into contact with adult cow feces. Now, this is particularly relevant for the calving pen when the calf is first born. In group calving pens, there can often be lots of adult cows, and their feces is in the straw. So the calf comes into contact with that very early on in life. So you want to have really clean calving pens, free of adult cow feces if possible, and removing the calf as soon as you can after birth is a great way of limiting their contact with adult cow feces, removing them to a separate calf pen. Also, when it comes to colostrum, it's important that if you have a cow who tests positive for iones disease or is showing clinical signs of iones disease, that you don't feed her colostrum or her milk to calves. So feed colostrum from ideally test negative animals. As some farmers will have heard, pooling colostrum is also not recommended when it comes to controlling iones disease, because pooling from lots of different cows in the herd of colostrum typically would just slightly increase the risk that there could be a positive cow in that pool of colostrum who will then be fed to multiple calves. When you're feeding milk as well, it's possible that there can be iones bacteria shed into milk from infected cows. So ideally, if you're testing for iones, you would just dump you wouldn't feed milk from the infected or positive cows to calves. And if you want to completely nearly eliminate the risk from feeding milk, milk replacer really does reduce the risk that calves would come into the contact with bacteria through milk.
And I would say, Niamh, a lot of what you're talking about, you know, is implemented on farm. You know, when you talk about, you know, farmers identifying that positive animal, you know, and not feeding their colostrum. But I think, you know, you mentioned pooling colostrum, and that's something that has been very convenient. You know, farmers have done it out of convenience, but maybe that's something that does need to change on farms.
Yeah, I definitely think it's widely done, pooling colostrum, because you know farmers are very busy at that time of year, and anything that can be done to save time is desired, you know. But if you are particularly trying to control iones disease in the herd, it is definitely one of those things that you could be maybe considering how you could change that practice. And there are farmers out there who figured out very efficient ways of feeding individual colostrum to calves from individual animals. So it can be done. It might just take a new look at the organization of the system. But definitely the most important thing in my view is the feces. That's where I think the biggest risk lies. And if farmers focus even on that, reducing calves' contact with adult cow feces, they'll be doing a great job in terms of starting off controlling iones disease.
Niamh, a side point from the care of the newborn calf in relation to iones, but you mentioned, you know, a cow that is a positive for iones on the testing, or a cow that has shown clinical signs. Where should these cows calve down?
Well, they definitely are at higher risk of passing infection to calves. So an animal that is test positive or is showing clinical signs of iones, you'd want to be trying to calve them separately from the rest of the cows. So in an individual calf pen or a calving pen, or else outside if possible, because if you imagine that they are infected with iones disease and shedding it in their feces, that feces could potentially infect all the calves born into a group calving pen if that cow is in a group calving pen. So that's the reason you'd want to calve her on her own. And for the safety of her own calf, remove that calf from her as soon as you can after it's born.
That's great. Thank you, Niamh.
No problem. Thank you.
That's it for this week's episode of the Dairy Edge podcast. And my thanks to Michelle McGrath, Muireann Conneely and Niamh Field for joining me on this week's show. You can tune into the Beef Edge podcast this Wednesday to hear about the guidelines for feeding milk and concentrate in the diet of the calf. Don't forget to rate, review and subscribe to the podcast. You can listen on Apple and Google Podcasts as well as Spotify. And for more information, go to the Teagasc website at teagasc.ie. I'm Emma-Louise Coffey, and join me next time for your Dairy Edge.